Friends, I am Pranita Sheshni, the student of Bristol Training Center, and today I am here to discuss the pharmacological topic, that is the technical topic, that is the causality assessment. Causality assessment is a systemic process used to determine whether a specific exposure or the intervention has led to outcome or effect, particularly in fields like epidemiology, pharmacology, and the clinical research. Understanding the causality is crucial for making informed decision about the public health, medical treatments, and the policy. Now, key concepts in the causality assessment. In that, the first is the causation versus correlation. It is important to distinguish between the causation and correlation. Just because two events occur together does not imply that one caused the other. And the next, that is the Bradford Hill criteria. This is a set of principles that can help establish a causal relationship. In that, the first is the strength. Strong associations are more likely to indicate the causation. The next is the consistency. Similar results observed in the arguments for the causality. Next is the speciality. A cause should lead to specify the effects, although this criterion can be limited. Next is the temporarily. The cause must be procedure, the effect in the time. Biological gradient. A dose response relationship supports causation. As the dose increase, so does not effect. The next, that is the experimentation. Evidence from the experiments can strengthen the causal claims. The next, that is the analogy. Similar relationships in the other contexts may support a causal inference. Now, types of the studies. In that, the first is the observational studies, include the cohort, case control, and the cross-sectional studies. They provide the valuable data but the subject to confounding variables. The next, that is the experimental studies. Randomized controlled trials, that is the RCTs, are the gold standards for establishing the causality, as they minimize bias and the confounding. The next, that is the steps in the causality assessment. The first is the identify the relationship. Begin by observing a potential relationship between a exposure and a outcome. The next, that is the gather evidence. Collect the data from the various sources, including epidemiological studies, laboratory experiments, and the existing literature. The next, that is the apply criteria. Use the Bradford Hill criteria or other frameworks to assess the strength of the evidence for a causal relationship. And the next, that is the draw conclusion. Based on the evidence and criteria, determine whether there is a sufficient justification to conclude a causal relationship exists. Next, that is the report finding. Clearly communicate the findings analogically, any limitations and the need for further research. Now, there are some challenges in the causality assessment. In that, the first is the confounding variables. In that, factors that may influence both the exposure and the outcome can observe true causal relationship. Next, that is the bias. The selection bias, information bias, and the reporting bias can all impact the validity of findings. The next, that is the complex interactions. Many outcomes result from multiple causes and interactions, making it difficult to pinpoint singular causal relationship. Now the conclusion, that is the causality assessment is a fundamental process in understanding the health related outcomes and informing decision making by carefully applying the established criteria and considering the context of finding. Researchers can more accurate determine the nature of relationship between the exposures and the relationship between the exposures and the effects. Continued research and methodological advancement are essential for improving the accuracy and reliability of causal inferences in the variable fields. I think it is clear to everyone what is the causality assessment, steps involved in the causality assessment, and types. Thank you, friends, for listening me today. Thank you again.